Good morning, everyone. My name is Aaron Jarnigan, and I'm the digital marketing specialist here at Grow Cedar Valley. And this is our live stream webinar series that we've been having for a while. And we're very blessed and fortunate this morning to be joined by the executive director of Grundy Mental Health Center, Tom Eachus, who's going to be talking today about mental health and business and how important that is for managers and business owners to understand, especially as it relates to employees during this time. Tom has done a lot of work preparing, and so Tom, without further ado, I might just let you take it away. Thank you so much for being here.
Thanks, Aaron. I appreciate it. Good morning, Cedar Valley. As Aaron indicated, my name's Tom Eachus. I'm the current executive director at Grundy Mental Health Center here in Waterloo. I've been with the Mental Health Center 32 years now. And for those of you that know me, I frequently reference that I grew up in the place. My dad worked here for 28 years, so I'm working at a place that I've been running around since I've been 5 years old. So our topic today is mental health in the Cedar Valley. So a few things, and I don't like statistics, but I need to let people know my frame of reference. Basically, 1 in 4 Americans are going to experience a mental illness in their lifetime. That's about 50 million Americans. So if you are an employer and have a workforce of 20, you've got probably that 20-25% of the people who either have a mental illness or have a family member or a friend or a loved one that may have a family mental illness. So these disorders as a whole are more common than arthritis, diabetes, heart disease, or cancer. And despite the prevalence of mental health in America, 60% of the people never receive any treatment services. That's primarily because of the stigma that we've been fighting for a number of years. There's something inherently wrong or bad about the person that has mental health problems. And really what we've been trying over the last 10, 20 years is to define it as a physical illness. It's no different than type 1 diabetes. If you're diagnosed with schizophrenia at the age of 17 or 19, you are going to essentially die with that illness, as we haven't cured anybody. There's a huge difference between mental health problems and mental illnesses. If any of you have any friends who are from the Parkersburg area, you know about 11 years ago, the town was destroyed. There were a lot of people in Parkersburg that never, ever, ever would have considered seeing a mental health professional or a psychiatrist. All of a sudden, overnight, they're not sleeping, they're not eating, they're irritable, they're driving through stop signs because their brain is someplace else. They've lost everything that they've had in life. So they had mental health symptoms that were not a mental illness. Had they not received some type of services, whether it's education, training, support, they could have developed symptoms that we all know of as PTSD. So there are some people from Parkersburg still struggling years later because of what happened to them. There's some other people, because of their support systems, because of what they used to deal with the problems or symptoms or issues that they were having at the time, have recovered. Another important statistic is 50% of all lifetime cases of mental illness develop by the age of 14, 75 by the age of 24. What that should tell us is we have opportunities to intervene early. While we know most mental illnesses run in families, there's something going on genetically or hereditarily that people develop these illnesses. Knowing the statistic that I just referenced, we have opportunities to intervene early. Right now, as an indication of that, the Waterloo and Cedar Falls Community School District actually pays the Mental Health Center to hire and place 12 full-time mental health professionals in their school systems, because if we can catch those kids early, we may not be able to prevent some mental health problems from developing, but we can certainly mitigate the damage that occurs by going untreated. The last statistic I'll throw at you is most people wait 7 to 10 years before they ever get diagnosed or effectively treated. And that's a wasted opportunity that people have. And the longer people live with problems, usually the more entrenched those problems become. Why are we dealing with 60% of the people that don't get services that need it? Stigma. There's, again, something inherently wrong with people that have mental health problems. Some people believe they can't afford it. For those of you that pay taxes in Blackhawk and Grundy County, you probably own a few bricks in our building, as we do receive some taxpayer money to do what we've done, a lot less than we used to with expanded Medicaid. People that don't have insurance, that feel they can't afford things. 99% of Americans don't like to take medications, and we don't arbitrarily medicate people. But if you go into your doctor and say, doctor, I'm urinating all the time, I'm thirsty all the time, and I'm sweating bullets, and they do a blood test and you've got a blood sugar of 842, they certainly aren't going to talk to you about your diet. They're going to give you a medication that controls your blood sugar, and then they can talk about intervention. So mental health in the Cedar Valley, let me widen that scope just a little bit. In Iowa, we are 44th in the United States in having a workforce to draw from. I can't find staff. We are 46th in the United States in having enough psychologists per our population. We're 47th in the U.S. in having enough psychiatrists, and we happen to be 51st in having enough public psychiatric hospital beds. So if anyone wants to know why Iowa has problems with mental health and you hear the horror stories, it's because there are severe shortages and we haven't developed the policy or infrastructure or support to provide services in the community like the original Mental Health Centers Act of 63 envisioned. COVID has made things worse. We've got 6,000 people who come to the Mental Health Center on a regular basis for their services. We never closed during COVID. We've certainly moved, like many have, to a virtual and telephonic platform, but we've always had people coming in the building. People with pre-existing mental health problems before COVID are finding those problems have been exacerbated. Anxiety, depression, loss, grief, frustrations with when is this going to be over, uncertainties about the future, not to mention job loss, loved ones who have died, an inability to have some closure because we can't go to funeral homes, we can't visit loved ones in the hospital. So everything that was there before has basically become magnified. And we're starting to see with the reopening, those problems become more and more. We believe there will be a surge in mental health cases following COVID, or that we're already seeing, and it is likely to get worse. So what should you guys as business owners and HR personnel be aware of? Certainly people that are back who are missing work on a regular basis, who never missed work before, people who are having conflicts with their coworkers that really didn't have conflicts before, people that are having problems fulfilling the duties of their job. You may want to think, number one, is there something going on with their mental health? There may be a whole lot of things going on in terms of family finances, family health. Stress affects us in multiple ways, folks, physical, emotional, behavioral, and cognitive. And when we are not aware as employers of what's going on in our workforce, there's a lot of things going on behind the scenes that we may not be aware of, that you may want to be aware of. Many of you have EAP services within your organization, which are a great resource for people to basically be able to go in or go someplace to talk to people to deal with some of these issues. So without putting the cart too far ahead of the horse and going through a whole lot of things, I've developed, with the assistance of some other folks and resources, a laundry list in a one-page document about how stress affects people. And the other one is what employers and HR people could be looking for that might signal there might be some stuff going on in the mental health area. So I can send people resource. I'm always available for questions, comments, concerns. But there's a lot going on in the Cedar Valley. The one thing that, I have certainly made a commitment to in my career here is increasing the access and availability of mental health services. To give you a brief point, it was not too many years ago where any one of you could have called us or pretty much any other mental health agency in town, and they'd say, we can get you in about 3 weeks at 2:00. Does that work for you? Most people don't know what they're going to be doing 3 weeks from now at 2:00. And most people it takes a lot of effort and gumption to pick up the phone, and I need some help. I'm depressed. I'm having some bad thoughts. I can't get along with people. My anxiety's off the top of the roof. So the fact that people pick up the phone and then get told that it'll be a month or 2 months. I talked to my sister in North Carolina who wanted to have a family friend go be seen for mental health services. They can't get in to see anybody for 3 months down in North Carolina. So in 2013, we developed what we call an open access scheduling system. Monday, Wednesday, and Friday during certain hours, people can just walk into our office and they'll be seen. Not by a psychiatrist, but by a mental health professional. And we can at least get people into the system rather than the horror stories that we hear about people waiting. And I've made a commitment that I never want to be a party to someone ending up taking their own life because they couldn't get services. Unfortunately, that's what happens when people live with the stigma that they feel that they're going through this themselves. So there's a lot of benefit to reaching out to people and asking how they're doing and that you're not alone, especially with all the implications of COVID. So I will shut up briefly. I will have Aaron get you guys my contact information if people want any of those resources. Otherwise, Aaron, I am open to any questions, comments, concerns that people want to throw at you.
Yeah, absolutely. So one did come in, and again, before we continue, I would encourage if anybody does have a question, we're going to take the next few minutes just to answer those. But Tom, we did have one come in from a friend of ours named Kevin, and he asked, how can someone suggest therapy or help to friends and families without coming off as
I think
negative?
the simple, if you've got a relationship with that person, it may be an opening that you seem to be struggling. Is there anything going on that I might be able to help you with? A lot of people dealing with mental health issues believe that they're alone, that nobody else is going through this, that they feel isolated. They aren't sure what to deal with this. So sometimes it's just the opening. You seem to be troubled. Is there anything going on that you're wanting to talk about? Can I help you? I've had pastors, I've had coworkers, I've had family members bring people to the office because it's a scary thing to go in and talk to somebody about mental health type of issues or symptoms. So sometimes it's taking the time to simply say, how you doing? Things don't seem to be going as well as they used to. What can I do to help you? And then getting people to those resources, whether it's HR or EAP, or sometimes picking up the phone and calling. I've always been helpful to other people in terms of at least, you can drag a horse to water. You can't make them drink, but at least the opportunities to say that things can get better and there is help available.
Awesome. Thank you. And thank you, Kevin, for sending in that question. This was kind of a spinoff and one of my own. I'd be curious what your advice would be. So say you have a supervisor. I know that a lot of people who are managing people right now, it's a hard time, especially with COVID and uncertainty and emotions. What would you recommend if you notice a supervisor or manager who might seem to be struggling in their position, just potentially with some mental health concerns?
I think the same approach. I think it does become a little different when the supervisors or the managers or the leaders or the owners are struggling themselves, because we're usually seen as the people leading the charge. And if we're dealing with their own issues, I think finding those same opportunities to reach out. There's a lot of people that have a very strong religious belief, and most pastors are trained in counseling services, and there's resources available there. There are a number of opportunities to, refer yourself to EAP. Allen's got an EAP. Pathways has an EAP. There's a lot of EAPs that may be a benefit from your insurance program, but those of us in leadership positions are not exempt, Aaron. So all of us are subject to the impacts of stress in life from a lot of different sources. And I think COVID has simply magnified those things, from financial to family to health. I can give you a laundry list of things that are stressful to people. And I think managers and supervisors need to make sure they're okay in order to lead other people and be helpful to other people. So taking care of yourself is very important.
Awesome.
What people usually do for stress, if that's not working, you need to find some other things. And there were two things. There was a recent study that came out in regards to COVID. 3 simple recommendations was disconnecting from social media and not listening to it 24 hours a day, a regular diet, following a routine, and taking the time to pursue hobbies and spending time outdoors were the 4 things that this research project found is most helpful to people. And while that makes sense to me, that's not news, Tom. A lot of us are not very good at following the advice that other people give us.
Awesome. Well, I haven't seen any other questions come in for now, and we can wait just a couple minutes. Tom, how did you end up with your position and kind of your background leading up to the position you're in today?
So as I said, I came by it naturally. I'm a social worker. My dad was a social worker. My mom was a nurse. My sister's a nurse. There's got to be a research study there someplace, Aaron. But the usual stuff in school, church youth groups, Boy Scouts, helping other people. Started out in psychology at Wartburg a long time ago, switched to social work. Worked at the State Mental Health Institute off and on for about 6 years and started here in 1988. And like I said, I've been running these hallways for a long time. So I'm doing exactly what I've always wanted to do. I still carry a caseload. I see clients or patients. I do a lot of community presentations. That's the other thing. I mean, ourselves and many of the EAPs in terms of lunch and learns, in terms of posters, in terms of, having an opportunity where employees are taking a break. I went down to Dysart a couple months ago just to talk about mental health. Sometimes it's important to have people have an opportunity to get some information. So I think there's a lot of ways you can do it rather than having to refer people to EAP or mandatory supervisory referrals. There's a lot of things you can do to educate people to make them aware of resources. So that's kind of how I came to do what I'm doing.
Awesome. Well, I didn't see any other questions come in. So Tom, I just again want to thank you so much for coming in and speaking on this morning. Again, Tom is the executive director for the Blackhawk Grundy Mental Health Center here in the Cedar Valley, and I'm sure as always they'd be more than happy to help. And we'll share some contact information in the comment after this live stream is ended. But as always, stay tuned, stay healthy, Tom, and again, thank you so much for your time this morning.
Thanks, Aaron. I appreciate everybody's attendance this morning.